Welcome to PSC Talk. We have two board-certified plastic surgeons here to answer your plastic surgery questions, and we have Beverly on the line. Beverly, do you have a question for us?
Hi, yes. I'm looking into breast augmentation, but I'm confused about all the different shapes and textures of the implant.
Their breasts are going to determine what the final outcome is the most. And so I like to try and match the breast tissues to the best implant available for them.
How do you help them decide?
Well, first of all, I have to say it's an exciting time as a plastic surgeon and as a woman because all women come in different shapes and sizes themselves. And so it's nice to have different projections and different widths and different textures and shapes to really match the patient's goals with what is available to help them achieve that. So I completely agree with tissue-based planning and utilizing measurements and the amount of soft tissue and skin laxity, et cetera, to help kind of marry the patient's desires with outcome.
I'm also wondering, does fat work for breast augmentation also?
I think she's referring to fat injections, taking fat from one part of your body and injecting it into the breast to try to achieve a breast augmentation. I personally use it for shaping or helping to cover up maybe rippling or a sharp edge, or to maybe augment an augmentation, if you will.
I tell patients it's kind of a thickener. So if you have thin tissues where you have wrinkling and rippling, different issues like that, it can be used to thicken the soft tissue.
And where is this fat coming from typically?
Most typically from the lower stomach or the inner thighs, maybe the flanks.
So they're kind of getting a 2-for-1. I mean, who doesn't have a
Yeah.
little
So to
bit of
speak.
fat,
Yeah,
right?
yeah.
That they want to get rid of.
Yeah,
So-
I always tell patients it's like a hair transplant in men. If we could choose where we want our hair and where we have our hair, it'd be great. So
Yeah.
you can actually choose to remove your fat, transfer it to a place where you don't want it, to a place that's beneficial. So it's a kind of a win-win.
Thank you, doctors.